federal funding for abortions.
That is correct.
Okay. You mentioned your district now a couple of times, and I hear your point loud and clear that it is the role of any member of Congress to first and foremost represent the concerns of his or her district. So tell me more about your district and why your district you felt needed this kind of health care reform package in the House to be supported by you.
Well, the New Orleans area was stated by Hurricane Katrina 4 years ago. Our healthcare system is in a shambles. Many of my constituents are poor. They do not have access to healthcare. They don't have medical insurance, and therefore, if this healthcare reform passes, it will provide people who cannot afford healthcare right now the federal subsidies to obtain healthcare insurance. So I believe that the bill itself will help at least a fifth of my constituents here in the district to obtain medical insurance.
I want to ask you about 3 different constituencies because I know that you had to be in constant communication with all 3. Let me ask in no particular order about your constituents first, since we're talking about them. What kind of interaction did you have with your constituents over the summer leading you to vote the way you did?
I've had about 11 town hall meetings all over the district, from West Wego over to Kenner, into uptown New Orleans. And obviously there were people who were very vocal against the reform package, while many others, they were supporting the bill, conveying that the district needs access to medical care. So I really had a lot of mixed messages from my constituents, and there were more people in support of healthcare reform than those who oppose healthcare reform. In
those 11 town hall meetings, were you subjected to the kind of screaming and yelling and threatening that we've seen make some of the news media rounds that other members of Congress were subjected to this summer?
Yes, there were a couple of, actually several town halls in which people were quite vocal in conveying their displeasure with the healthcare reform bill.
Okay.
But I was able to explain to them many of the controversial provisions and to calm down and to clarify some of their concerns.